meals for older folks. It's my favorite. First week, no food for the old. Well, I don't make a lot of money, so they don't even see anything other than more than 250,000. HIV, and many of you have some information on it, but Dr. Sarah Bass will be speaking with you today. She's a faculty member in the Department of Public Health, director of our undergraduate program. A great faculty, won awards for teaching. She doesn't.
Oh, great! Yeah, set that up for me,
but
right?
You have to raise the bar a little bit, and it's really a privilege to have her come in and speak with you. As I told you this last week that she was coming in, so she'll let you know how she wants you to deal with questions and all that. But let's say thank you for coming in to Dr. Bass.
Hey guys. I'm glad to be here. I haven't actually gotten to talk about HIV for a while, but I'm putting in this big grant proposal on Monday that has to do with HIV, so I feel like it's kind of, all coming together. So as Dr. Siegel said, I will be talking a little bit about HIV. What I'd like to know from you guys is how many of you in high school had information on HIV? Okay, so I would say it was about a third. Okay, so those of you who had it, what did they do? Like, was it just one session in health class, or did you do longer stuff? Anybody? Yeah.
Longer, it was like a week or two.
Okay. Did you go to private school?
No.
Okay, good. All right, so you've had a lot. You want to come up and teach? You sure?
I don't think I'll teach about like sports or something.
Okay. How about the rest of you who raised their hand? What else? Yeah. Okay, so outside of when you were in high school?
Yeah, but it was through the high school.
Through the high school. Okay. Anybody else? Anybody have it like just for one day where they kind of talked about what it was? No? Okay, so for those of you who didn't have any kind of information on HIV, did you do any sexuality education? So I see some no's. Any?
We had sex ed in 8th grade.
Sex ed in 8th grade, so it was kind of, these are the parts.
Yeah.
These are how the parts go together. This is what you shouldn't do.
Yeah.
And that was it,
Mm-hmm.
right? Yeah, that's what my daughter's in right now. She's in 8th grade. And she comes home and she's like, what's this? Okay. So it's interesting to me because I've worked in HIV for a really long time, like 20 plus years now. And when I first started, which was in the late 80s, when HIV really kind of hit the scene, and there's this new infectious disease, and nobody knew what to think about it, and nobody really knew what was happening, we had this explosion of funding that went into HIV education and prevention programs. And so I worked in community-based programs. I worked for health department doing kind of large-scale information. Hello. And we saw a lot of education going on in the high schools, and even in middle school. So we would go out and do presentations, and they were developing curriculum, and all of this stuff happened. So if I'd asked that same question even 10 years ago, almost every hand would have gone up. And all of you guys would be like, oh, I'm so sick of hearing about AIDS, because you just heard about it all the time. And within about the last decade, we've seen this huge decrease in the amount of information that gets out about HIV, especially within school systems, which is really unfortunate because the behavior hasn't really changed too much, in that we are seeing a lot of unprotected sex, especially in young age groups, because they haven't gotten the repeated messages about using condoms like they used to. And so we also have seen in a lot of the surveys that the number of kids who are using condoms has gone down quite a bit. And so what do you think the result is? What's the result of not using condoms?
Increase in STDs.
An increase in STDs and HIV. So unfortunately, a lot of people have said, well, we kind of have taken care of HIV now, right? Okay. So some people say, oh, Magic Johnson, he got cured. Right? How many people have heard that one? He's not cured. He's on a type of treatment that allows him to live pretty healthily because his HIV is in check. But he also has the funds and the ability to do that. And the problem is that a lot of people are getting HIV infected now. So we're seeing a really large rise in the number of HIV infections in the United States in people your age because the messages aren't out there. So that's kind of why it's like to set that up in thinking about when we're talking about HIV. Okay, so what is it? So this is the stuff we should all know, right? HIV stands for human immunodeficiency virus, okay? So it's human because it only occurs in humans. So if you hear, when I was working in the West Virginia Department of Health, that's where I started HIV work, I used to get phone calls because I ran the hotline, and I get these phone calls that would say things like, if I have sex with my dog, it was really weird. But other animals can't get HIV. There are some viruses that infect some forms of monkeys, and there's a cat virus that's similar to HIV, but they're actually called different things. So there's SIV, which is simian immunodeficiency virus that affects some of the monkey species. There's cat leukemia, it's called, which is a type of virus like HIV that affects cats. But HIV is only a human virus, only transmitted from human to human. Immunodeficiency because it attacks the immune system. So what's the immune system? What is it? What's it do? Yep.
Yeah, protects you against diseases.
Okay. So your immune system is your line of defense against foreign particles, right? We're sitting here, there is bacteria everywhere, right? So there is bacteria on the surface of your skin and in your eyelashes and on the surface of everything that you touch. Our immune system helps protect us against that stuff. And that's an important thing. So the problem with HIV is it doesn't really make you sick. What it does is attack the immune system in your body so that you then become vulnerable to everything else that can make you sick. And that's why it's called Gesundheit. That's why it's called a syndrome, which I'll talk about here in a second. It's a virus. What's a virus? Okay, let me ask it this way. What's the difference between a virus and a bacteria? Anybody know?
Can bacteria be treated with an antibiotic?
Bacteria can be treated with an antibiotic, and a virus cannot. Anybody know why?
Viruses don't leave the body.
Okay. Viruses don't leave the body. Your body can clear a virus sometimes.
Sit in the spine, though?
I'm sorry?
Doesn't it sit in the spine, the virus?
HIV can, yeah, but viruses in general I'm talking about. So a bacteria is a living organism that can live on its own. It can live on a surface of a door handle. It can live in the air in a little droplet of spit when you talk. So I'm like standing right in front of you guys. I'll stand here. So a bacteria is something that lives on its own. And so as a result, you can give medicines like antibiotics to actually kill that bacteria. A virus, however, doesn't have its own genetic material. And the problem with that is if you get infected with a virus, the virus has to attach itself to some cell and take over that cell's genetic material, like its RNA and its DNA, to be able to multiply itself. And when it does that, it actually infects the entire cell. And so to actually get rid of the virus, you not only have to get rid of the virus, but the cell that it's inside of. And because of that, we don't really have good medications that treat viral infections. What happens is usually the immune system attacks that virus and it kills it and the cells enough, and it goes into action and it creates other kinds of cells to try to deal with that infection. And usually after a period of time you get better. So if you think about what happens when you get sick, right? You get a cold, you feel bad for 3, 5, 6 days, and then your immune system kind of kicks in, and after that period of time you feel better. What happens with HIV is that doesn't happen because the virus actually attacks the immune system, which is trying to get rid of a virus. All right. So AIDS is also an acronym, stands for Acquired Immune Deficiency Syndrome. Okay? Acquired means that you have to get it from somebody, right? You just aren't born with it. And when I say born with it, there are babies that get HIV, but they get it from their mothers, right? It's not a genetic disorder that just occurs for them. So acquired, you have to get it from someone else. You have to do something to get it from someone else. Immune deficiency, again, because it affects the immune system. And it's called a syndrome because it affects the immune system. it actually almost never causes illness directly. So what happens is, because your immune system is depleted, you get all these other things, like cancers and bacterial infections and stuff I'll go through here in a second. And that's why it's called a syndrome, because it's a group of a whole bunch of different diseases. And that's when people get sick and die. So the people are dying of other stuff. They aren't really dying of AIDS. So when you hear people say, oh, they died of AIDS, it's actually not really correct. What they're dying of is pneumocystis pneumonia or Kaposi sarcoma or cryptosporidiosis or all of these different diseases that they can get. And because their immune system is so depleted, they can't fight them off. All right, this is what it looks like. Okay, so this little white thing.
They have a laser on it.
Oh, see, I've never used the laser. There you go. Okay, so this thing is HIV attaching itself to a cell in the immune system. These things are how it docks onto it, okay? And then what it's going to do is infect itself into the nucleus of that cell. Here's a color picture of it. So see all these little red things? Those are all little new HIV cells ready to burst out of this. This is a T cell. And what's going to happen is all those viruses are going to come out and they're going to attach to other T cells in the immune system. And I'll talk about what the consequence of that is in a second. And then this is showing how HIV is starting to take over the nucleus of a cell, and it's going to start to develop its own HIV cells. All right. So HIV overall would be seen as, some people call it an epidemic. It's actually a pandemic, meaning that we see HIV all over the world. It's rapid, widespreading, very contagious disease. And worldwide, it's estimated that there are about 33 million people who are infected with HIV. In the US, about 40,000 new people every year are being infected with HIV. This is an increase from about 10 years ago when we had about 25 to 30,000 new infections every year. We have a total in the United States of about 1.1 million people who have HIV infection, the majority of whom do not even know they have it, right? So they're actually people who have gotten infected, usually through sex, and they don't know they have it because it takes a long time for HIV to actually show up and cause symptoms, which I'll talk about here in a second. The problem is that the majority of those people who don't know it are then spreading it to other people because they don't know they have it, and then those people aren't knowing that they have it either. All right. So this is a global view of HIV infection. It shows you the kind of penetration rate all over the world. Obviously, the red areas in sub-Saharan Africa are where the majority of the infection has occurred worldwide. In some of these countries, literally 1/3 of the population is HIV infected. So you're talking about 1 in every 3 people are suffering from HIV infection. Other areas of the world where we're seeing increases, especially up here in Russia, the Ukraine, those kinds of areas, we're seeing a fairly large infection rate. And India, we're seeing a big infection rate as well as along here in Southeast Asia. Okay? The United States has held fairly steady in its overall prevalence of HIV infection. Now, that's a good thing in that we did put enough money into it at the beginning that we're not seeing a huge increase in of infections, but it's still much higher than both Mexico and Canada. It's also much higher than anywhere in Europe and over in this area of the world, Australia. Okay. This gives you just an idea of how many total people are infected worldwide. So you can see, just in sub-Saharan Africa, 22 million people infected with HIV. So you have huge numbers of children infected by mothers. You also have huge numbers of orphans. So if you look at the death rates, and I know Dr. Hegner is going to come in next week and talk more about this, but if you look at death rates in some of these sub-Saharan African countries and how long people are living, the average lifespan of someone, let's say, who lives in the Congo is maybe 42. Okay? What is it in the United States? Anybody know? It's higher than that. It's in the 70s now. Okay, so 72, 73. And if you get to 65, it's actually into the 80s, upper 80s. So if you live to be 65, you're expected to live usually until you're about 85. So huge difference. Yeah?
Why do you think there's such a big disparity between the number of people who live east and North Africa and sub-Saharan?
Good question. Part of it may be just where the infection began. I'm going to talk about that in just a second. Part of it also might be that a lot of these countries are way underreported. Okay? So a lot of the activities that bring on HIV infection, which are sexuality and drug use, are not accepted culturally in these parts of the world. And so a lot of people who have HIV are never actually reported as having HIV. They just die, and they're never marked as someone who has it. Okay, so origins. So this is always an interesting one. So you guys tell me, what kinds of things have you heard about where HIV came from? Yeah. Okay. So that's one of them. I'll talk about that in a second, is monkeys. Yeah, did you have one? No? Government. Okay, so the government is a man-made virus. What else? Sorry, standing in front of people's way. Anything else? Okay. I always talk about where HIV came from is a tiger in the house analogy, which is if you had a tiger in your house, what would you be most concerned about? How it got in there or how you're going to get the hell out of your house? Right? So the real issue is with any disease, we have no idea where any disease comes from. These are naturally occurring bacteria and viruses that are trying to live their lives as a species, just like you are. So we don't know where malaria comes from. We don't know where strep comes from, MRSA, colds, the flu, et cetera, et cetera. Okay? The point is it's a virus that occurs naturally. It's not actually new. So a lot of people say, well, it's new and that's why it has to be man-made. Okay? We've actually shown that because HIV has such a long incubation period, which I'm going to talk about in a second here, that it took a long time for us actually to recognize that there was this disease out there. So we've been able to isolate HIV in blood samples as far back as the 1940s of people who died with odd symptoms that were, the doctor was like, what happened to this patient? I don't know what happened to this patient, so let's save their blood. Stick it in a freezer. If you pull it out and test it, it actually had HIV in it. So it's not something that just started in the 1980s. It's actually been around probably over or almost close to 100 years. It's just that it takes a period of time for disease to occur on an international level to a point where we can recognize it. Some of the government conspiracies. Honestly, I know enough about microbiology to know that we are not smart enough as a species to have come up with this virus. It's a type of virus that we don't even know how it completely works yet. So I understand the ideas about government conspiracies. The problem with government conspiracies is that if it was a government conspiracy, they did a really bad job at it. It's like a really crappy job at trying to get certain kinds of people, because it's not just certain kinds of people who get HIV. There was a lot of press a few years ago about this idea of immunizations, that somehow we created HIV and that it was part of the immunizations that were given, especially in Southeast Africa. And that's been debunked by a lot of biological testing to look at original samples of the immunizations. Most likely what happened, and there's been a lot of evidence over the years that looks at this idea of the simian immunodeficiency virus. So there's a virus in simian monkey species that is very similar to HIV. And it's got about 98% of the same DNA as HIV does. Many of these monkeys are delicacies in certain parts of the world. So they are caught and they are skinned and gutted and eaten, okay, just like we eat cows and pigs and whatever. And the idea is probably 100, 150, 200 years ago, when this happened, a simian virus infected a human, and over time, it has mutated into what we know of as HIV. So there's a lot of evidence for that. It's not that somebody had sex with a monkey. Okay, so we hear that a lot too. So how does HIV affect the immune system? Well, HIV is a special virus, and this is what I'm talking about with a government conspiracy, is that it's not even a regular virus, it's called a retrovirus, which means it works completely differently than most viruses. So most viruses have DNA, it needs RNA to be able to multiply itself, and that's why it takes over a cell. HIV actually only has RNA. RNA has very little genetic material in it. So it has to go into a cell, take over its nucleus, and then reverse its RNA into DNA to make itself, which there are only about 3 or 4 retroviruses that we've identified out there. So it's a really special kind of virus. And the main thing is that it attacks this what's called a T4 or CD4 helper cell. These are a very key cell in the immune system. And I'm going to talk about that in a second. So this is what, again, this is a little HIV. It's looking for a CD4 cell or T4 cell. So see how it has these little things that stick out on the side? Okay. So this is a schematic of what that looks like. These are little proteins that stick out of the virus. And what it's doing is searching for a receptor that will match it. Okay? So it's just like you watch Star Wars or something, whether the spaceship comes in to dock at the mothership, and it's like, that's kind of how HIV is it has all of these little proteins, and it's looking for a mouth, basically, to put one of those little proteins in. And what happens is that this particular protein has an attraction for this CD4 cell. And when it docks on that CD4 cell, it injects itself into the CD4 cell and takes it over. All right. So I'm not going to go through these. These are just types of cells that are in the immune system that are important. Okay? They're the things that help you fight off colds and the flu and all of those kinds of things. The main issue is that these T cells, especially these helper cells, which are the T4 cells, are like the quarterback of your immune system. So what happens if you get a cold or the flu? What happens to your body? How do you feel when you get a cold? What kind of symptoms do you have? Headache, runny nose, you might have a sore throat, right? You may feel nasty, you just want to go to bed, right? And after 3, 4, 5 days, you start to feel better, right? It may get worse, it may get like really stuffy, but you feel better. That's because the immune system is attacking that cold virus, all of these different kinds of cells, leukocytes, macrophages, antigens, the antibodies, and the B cells. And it takes a period of time before the immune system takes over. What happens with HIV is it attacks these T cells. And these T cells are the ones that identify anything foreign that comes in your body. So if you get a cold or the flu, these T cells say, oh, we got an invader. We need to go into action. And it sends signals to all these other cells to do their jobs. Okay? When HIV gets into the body, it actually attacks that quarterback. And it takes out enough of those cells that pretty soon there are no signals going out to the rest of the immune system to know what to do. And so they just kind of run around the body, not knowing really what they should be doing. So it's like taking the quarterback out of the fourth quarter of a tied football game and say, okay, now you can go play yourself. Okay? That's what happens to the body with HIV. This is the biology of it. If you want to take the AIDS and Society course, you can know a little bit more about this. Okay? But in general, what it's doing is exactly what I said. It's docking onto the T cell. It's injecting its genetic material into the nucleus of that T cell. HIV has a enzyme called reverse transcriptase that actually transcribes or makes the RNA into DNA. And then as soon as it does that, it has taken over that T cell and made it into a little HIV factory. Okay? Pretty soon what happens is that the viruses are coming in. Okay, this is docking. It's docking on the surface. It's coming in, taken over, penetrating the nucleus. It's then now making itself new little viruses. Okay? And pretty soon you got so many of these things that they come and they start budding off the cell, and you've got so many new viruses coming out that this whole T cell bursts apart and dies because it has just taken over and made a factory out of it, and now it can't sustain itself anymore. So it dies, and then all these new little T cell viruses are looking for new T cells to infect to do the same thing too. So after time, what happens is that more virus gets made than T cells. And when you have more virus than T cells, you no longer have a quarterback in your immune system, and these things start taking over your body. Okay, so what happens now? All right, so we call this the HIV disease continuum. And I'm actually going to do a little thing here. Do we actually have chalk? I can't believe it. I know, right there. All right, so HIV continuum. So think about this as an AIDS timeline. So let's say I tonight go home, I have this horrible fight with my husband. I'm like, I hate you, I never want to see you again, and I leave the house and I go to a bar. And I'm thinking, I'm going to get back at him and I'm going to meet somebody, right? So I'm at the bar, and this guy comes and sits next to me, and his name is Harold. And Harold is an accountant, right? It's after tax time, right? He's happy because he's just gotten all his taxes in, he's made a whole bunch of money, he's having a wine. So I'm thinking, oh, Harold, he's an accountant. He's safe, right? Can't be somebody out there doing stuff that I don't know about because he's an accountant, and he just got done with tax time. So Harold and I go back to a hotel, have a one-night stand. And after this happens, I'm thinking, crap, what did I do? Right? Who was this guy? I have no idea who he is. I don't even know what his last name was. And I'm thinking, what if he gave me STDs, HIV, whatever it is? Well, come to find out, Harold's actually quite a player, right? And does this almost every night. And Harold is HIV positive, okay? So I've had a monogamous relationship with someone who's HIV negative. I go to a bar and have one sexual encounter with somebody. And my chance as a woman is actually 3 times greater of getting HIV from that partner than if the roles were reversed. Like if I had HIV and he had a one-night stand with me, he would be at less risk. Okay, that doesn't mean you guys aren't at risk, okay? But he does have less risk. So let's say I did get HIV. So what's going to happen to me now that Harold occurred? All right? So Harold occurred, and I am now HIV positive. What's the first thing that's going to happen to me? Anybody? Do you remember? Am I going to get like symptoms right away? Is this going to ruin my immune system? I see some shaking heads. So if it's not going to make me sick right away, what's going to happen to me? Like how long is it going to last? Say it again? 10 to 15 years. Okay, it's a little long, but you're close. So it actually takes a long period of time, and some things are going to happen to me throughout this time frame. The first thing is what we would call the window period. Okay. The window period is the time that you are infected to the time that you start to produce an immune response to having HIV. Okay. So it's not like our immune system doesn't know that something's happening. We do know that something's happening. And we start to develop these things called antibodies, which are just little proteins that run around trying to find the HIV and send signals to the rest of the immune system and come kill it. We produce those antibodies usually between 2 and 12 weeks after we've been infected. Okay. Now, why that's important is if Let's say the next day I had remorse and thought, oh crap, I need to go get tested, right? So I go to the health department down on Broad Street and say, I had a one-night stand, I need to get tested for HIV. And they would say to me, well, I can test you, but the test isn't going to show whether or not you got it last night, right? You're going to have to wait anywhere from 2 to 12 weeks to find out whether or not you really have HIV, because it takes that long for you to produce antibodies. Yeah, go ahead.
This is a blood test.
This is a blood test, yeah. It's also the rapid swab tests that look at your saliva, any of those, because they're all testing for antibodies, okay? And antibodies take that period of time to develop. What's important about that is, let's say I say, oh, I'm not going to tell my husband, I'm just going to go home and apologize, right? And then we have makeup sex. Well, even though I haven't developed antibodies yet, I can actually now transmit HIV to him. Okay? So I become infectious the moment I get infected. And I don't even know yet whether or not I have it. Okay? So 2 to 12 weeks. Then what happens is what we would call asymptomatic HIV infection. This is when, if I got tested, I would have antibodies, but I still have enough of my immune system left to really ward off anything that's going to cause any problems for me. Okay? This usually goes on for about 7 to 10 years, which means I have HIV, I can give it to other people, but I have no signs or symptoms of having it. Okay? So what happens is HIV sometimes lies dormant for a while, trying to figure out what's going on, and then sometimes our immune system is kind of keeping up with it. Okay? After about 7 to 10 years, I will start to develop symptomatic HIV infection. Okay? What's happening here is my T cell numbers are starting to drop. Okay, so a normal person has about 700 to 1,000 T cells for every milliliter of their blood. When I get into symptomatic HIV infection, I maybe have 400 to 500. Okay, so about half what I should. And when you have half the number of quarterbacks in your system, you start to develop some weird stuff. So what kind of symptoms might occur? Anybody remember? You might get reoccurring colds that just don't seem to go away or last a really long time. Anything else that you can remember? Oh, come on, guys. I know you've heard it. How about frequent diarrhea? So this is like diarrhea that just doesn't seem to go away, like not connected to, oh, I had a really bad piece of pizza or whatever it is, right? So it lasts forever. I had a friend who just had diarrhea all the time. Like he would constantly be talking to him, all of a sudden you run out of the room and you knew where he went. Okay? People also often get just a fatigue, where they just feel really fatigued and tired all the time. And again, that's part of their immune system being depleted. Some people get frequent yeast infections. So women get frequent yeast infections where they take the medicine, it maybe goes away for a couple weeks, it comes back. So it's just very frequent kinds of stuff. Some people get fungal infections in their mouth. So there's one called Candida, which is actually something babies get a lot. It's just a yeast infection in the mouth. You can kind of see a white film on the side of the mouth. You can kind of take your fingernail and scrape it. That's a sign that your immune system is depleted. Okay? So there are lots of things that might occur, but none of them are life-threatening at this point. So at this point, you've got, as I said, about 400 to 500 T cells for every milliliter of their blood. The end of this is where we actually have AIDS. Okay? And AIDS is defined as someone who has 200 T cells or less, or has what we call an opportunistic infection. Okay? So an opportunistic infection is something that takes the opportunity to take over your body when your immune system is depleted. So anything that somebody gets that could kill them because their immune system is so depleted is what classifies them as AIDS. So, I mean, I've known people, I remember I met one guy down in Baltimore, I said, what's your T cell count? He said 0. Okay? He was still alive, walking around, but his immune system was so depleted that really anything he came in contact with could have been a deadly infection. And people with AIDS get stuff that all of us in this room, if we have healthy immune systems, have no problem fighting off. Okay? So what's the timeline of this? Well, this is usually fairly consistent, about 7 to 10 years. The only difference would be is if you are someone who is pretty unhealthy to begin with. So maybe you have other kinds of chronic conditions that make your immune system lower. Maybe you're an IV drug user living on the street. You're not eating right, you're not sleeping right, the drugs are depleting your body. People like that get to symptomatic or AIDS much more quickly. Okay, so even like 12, 18 months. But for the most part, if you know when you got infected, this is the timeline that you're going to see. All right. How am I doing on time?
You have 35 minutes. Is that what possibly helped Magic Johnson, general fitness and the availability of
Sure.
cocktails?
Definitely. So his fitness, his ability to buy the latest medication, to get on all the trials, have medical care, et cetera, yes.
Because I remember it was his T cell that he was telling everyone, I don't have, my T cells are good, and that's why he was denying that he had
AIDS. Well, I'm not sure he ever had a diagnosis of AIDS. I'm not sure his, so just HIV, because he always had enough T cells to still be HIV infected. All right, so this is basically what I just said. We got the window period, we got asymptomatic HIV infection when your T cells is still normal. We go into symptomatic when they begin to drop, and then AIDS when they're 200 or less. Okay. So these would be some of the symptoms that you would see. Okay, so fatigue, fever, chills, night sweats. So this is like waking up in the middle of the night, in the middle of this, any time of the year, not just in the summer when you don't have the air conditioner, your whole body drenched in sweat, like so drenched that you have to get up and change your sheets. And sometimes that happens 2 or 3 times a night. Unexplained weight loss. It's usually more than 30% of your body weight. Not because you're stressed out, not because you're trying to get all your papers and finals done for school, not because you just broke up with your boyfriend or girlfriend. This is like really dramatic weight loss that usually occurs in a very short period of time. So I had a good friend who weighed probably 200 pounds, and he went down to about 135 in a matter of about 4 months. Okay, so very dramatic weight loss. Fuzzy white spots in the mouth. So I talked about that. There's another one that can occur in the mouth called hairy leukoplakia, which actually looks exactly like it sounds. It's like a white, hairy, rough patch, usually on the sides of the tongue. If you have a really smart dentist, he or she will be able to recognize what that is. It's actually a real determinant that you're moving into AIDS, because it really shows that your immune system's starting to go down.
Could you say that again?
Hairy leukoplakia. Leukoplakia, yep. Symptoms of being in AIDS, into that last stage of disease, memory loss or depression. A lot of people will get a bacterial infection in their brain, and if they get this, it causes very similar symptoms to Alzheimer's disease. Yep.
If you have AIDS, you said that the only real way that you can keep getting sick is if you run in contact with stuff, right?
Uh-huh.
So if you were to hypothetically live in one of those bubbles, you would not die of AIDS.
Not necessarily. It would definitely lower the chances that you would come in contact with an opportunistic infection. The problem is that HIV can attach itself to the digestive system and cause you to not be able to take all the nutrients from your food that you eat, and then that's problematic, so you could literally waste away and die due to that. So it probably would get you eventually. For women, abdominal cramping, a lot of this is due to pelvic inflammatory disease. Have you talked about that in class? or cervical cancer. So women who have HIV, who have HPV2, human papillomavirus, are at more risk of developing cervical cancer when they get HIV. Pink, red, purple, or brown blotches is a symptom of a very common opportunistic infection called Kaposi sarcoma, which is a skin cancer that a lot of people get. Persistent dry cough is a symptom of a OI called pneumocystis carinii pneumonia, which is a pneumonia that people get. It's a protozoa that lives in the lungs. And then blindness. Okay, so cytomegalovirus is a virus that people with HIV can get that attaches to the retina of the eye and causes you to go blind. It's not fun. Okay, so these are just some of the opportunistic infections. They're literally, if you go to get diagnosed, there is a list of OIs that's like a whole page long that people might get with HIV. These are some of the most common ones. Okay. Toxoplasmosis is that one that attacks the brain that I talked about that causes dementia and brain problems. Pneumonia I talked about. This one is something that you get from birds. I mean, there's some weird SHIT that people get, seriously. I mean, there are things that like only sheep get. So, people with healthy immune systems have no problem. Like if they come in contact with this stuff, it's just not a problem to their immune system. But when you have no immune system, literally, all this stuff takes over. Okay? Different kinds of cancers. And then these are things that also might happen. I talked about the severe weight loss. Wasting syndrome is a very common occurrence, especially in developing countries where they don't have access to a lot of high-calorie, high-fat kinds of foods like we do here, which for most of us are bad things, but for people with HIV are actually pretty good things because it helps them keep weight on. What happens is HIV attaches to the cells in the digestive system. So when you eat your food, even if you're eating regularly, you're not absorbing the nutrients and vitamins that you need from your food. All right, so where does it live? HIV cannot live on its own because it's a virus. It needs a cell to be able to replicate itself. Okay? So it can't just like hang out somewhere, like on a table, and have you pick it up like you can like a cold or the flu. All right? So, and because it lives in T cells, it has to go where the T cells are. So in the human body, T cells exist in blood, obviously. They also exist in semen, vaginal secretions, breast milk, okay, for pregnant lactating women. And then there are internal organ tissues and fluids where it can also live, like spinal cord and brain tissue. Okay? Those are the only places that T cells exist in your body. So that's where HIV is going to be. It's not going to be in any kind of body fluid that doesn't contain T cells. All right. So things like saliva, tears, urine, feces, nasal fluids. All right. Some of them have small numbers of T cells, but they are in such small quantity that it's not enough to cause a transmission. So I always use what I call this bleach analogy. So if I took, straight Clorox bleach and I poured it on your purple sweater, what would happen? Okay, and how would it change color? It would leave a big white spot, right? Because it literally is so strong that it takes all the color out of the sweater. If I take one drop of bleach, put it in a whole bathtub of water, and then put your purple sweater in it, would it do anything? No. And why is that? It's so diluted, right? It's so diluted it has no strength anymore. That's really what happens with HIV in these other body fluids. There are so few T cells in these other body fluids that you would literally, like saliva is the big one. Everybody's, when I talk to teens, that's the big one, right? So what if I'm kissing and we kiss for an hour, right? The problem is that with saliva, you would literally have to inject 1.5 gallons of saliva into your vein to have enough T cells to actually cause a transmission with HIV. The one good thing that we have about HIV is that once it's in the body, it is nasty and destructive, but it's actually a pretty wimpy virus outside the body, okay? So you guys heard of hepatitis B, right? Different kinds of hepatitis. If I had hepatitis and HIV, let's say I got them both from Harold, right? Carol gave me 2 presents. And I cut myself and I bled on top of the desk right here. Okay? HIV would be almost completely dead within 3 minutes. Okay? So it cannot live outside the body very long. Hepatitis B, which has a more consistent structure around it, so not going into microbiology, but just the levels of protein around it, are protective of it enough so that even when the blood was dried, 48 hours later, it still, if someone came up and had a cut and put their hand on it, could get hepatitis B from it. Okay? So if I got a needle stick, if I was a healthcare worker, some of you I know are interested in working in healthcare, and again, somebody was working on me because I was the patient and I had hepatitis B and HIV. My chances of getting hepatitis B is 1 in 3. My chances of getting HIV is about 1 in 270. Okay? So real difference in how strong it is outside the body. As a consequence, really the only things that put us at risk are things that put us in contact with the body fluids that have it. Right? So blood, sex, and birth, main ones. Okay. So sexual activities that exchange body fluids. Sharing needles, especially IV drug users. Okay. And passing the virus from a mother to a fetus. Yep.
What are the actual odds of getting AIDS or close to it in one encounter with somebody uninfected?
You know, that's hard to really quantify. What they do see is that some of the studies have looked at what's the risk, kind of relative risk for a man or a woman. It's, you know, I always talk about it's kind of like getting pregnant. It could happen the first time. It could happen the 250th time. It's kind of the same idea, but that women are more at risk than men, and that's mostly just biology, which I'm going to talk about here in a second. So I can't like give you an exact, you know, right. I can't really give you a percentage like that because it's just like getting pregnant. Right? Yep.
Wouldn't you say it's not, I know you don't want to say it, but wouldn't you say that it's not necessarily if you're exposed to an individual, you will get it because we have a lot of things going for us and the virus does die easily. Mm-hmm. But as soon as you increase your behaviors and risk,
you open yourself up to it.
Yourself up. So
definitely.
We don't want to ever say the odds are low.
Right.
Because if you're pregnant or have HIV, it's something you don't want to get. So it's
yeah, definitely.
I don't think they know.
Definitely. Breastfeeding for an HIV positive mother puts her baby at risk. Sharing sex toys. I hear you had a fun sex toy person come out and talk to you. And then accidental contamination with infected blood. This doesn't happen very often. It's usually healthcare workers or first responders who might come in contact with large amounts of blood. Right? So we're not just talking somebody scraped themselves, right? It's usually like, I mean, one healthcare worker got infected because she put her bare hands into the chest cavity of a man trying to massage his heart. Okay, so these are like, you know, really big exposures. All right, so let's talk about sexual transmission. Sexual transmission can occur in a variety of different ways. The most risky behavior is anal intercourse, and that's especially risky for the receiving partner, right? You got the picture in your head, right? So the person that's receiving, that's because of anatomy. The anus has a lot of blood vessels right close to the surface of the skin. The skin is very fragile and is ripped and torn very easily. So if semen is deposited into the anal cavity of either a man or a woman and they are infected, HIV has a direct route into the bloodstream of that person. Okay? The person who is actually the active partner is less at risk because the penis is actually pretty protective. All right? Vaginal intercourse, same idea. Women are most at risk, which is true for every sexually transmitted disease, right? That's because the vagina is an internal organ, right? It's nice and warm in there, so HIV doesn't get killed right away like it does out in the surface, you know, if you bled somewhere. The vagina is meant to suck everything into it. It is a big mucous membrane, okay? And so when infected semen is deposited there, it can stay in the mucous membrane to find its way into the bloodstream, to find those T cells. Now, that is not to say that men are never infected the reverse. Okay? So there are some things that put men at more risk. Having another STD that causes some kind of abrasion or canker on the surface of their penis puts them at risk because it's a direct route into the bloodstream. This, at the head of the penis, you also have mucous membrane. So it's possible to get infected vaginal secretion into the head of the penis, and it finds its way in that way. We've also seen some studies that uncircumcised men are more at risk because when they, after an erection, the foreskin pulls down over the penis, the vaginal secretion has a nice warm place to sit in to try to find its way into the body. Okay? And then oral sex, also risky, not as risky as anal or vaginal sex. And that's mostly because the mouth is a pretty protective place for a lot of things. So the person that would be at risk in oral sex is the person who is performing it. Okay? So because what's happening is you're getting vaginal secretion or semen into the mouth, and if you're swallowing lots of it, if you have a cut, if you have bleeding gums, which a lot of people have bleeding gums, a cold sore, those are avenues for HIV to get into the bloodstream. Okay? The good part of it is that the mouth has a lot of protective enzymes in it. So we have a thing called mucin, M-U-C-H-I-N, which actually protects against HIV binding with a T cell. So we see a lot less infection happening for oral sex, but it is still a risk. And then sex toys, especially if they're being shared. So if you're using a sex toy, if you get vaginal secretion or semen on a sex toy and then give it to someone else to use, then that's a problem. All right, blood transmission. Main issue is sharing needles. Okay? It doesn't have to just be through IV drug use. We've seen HIV transmission through unsterile tattooing, piercing, and steroid use. Okay, so any time a needle gets shared between two people where there might be blood exposure. The reason that sharing needle, especially for IV drug users, is so important is that, if anybody, any of you guys seen the, what's that Quentin Tarantino movie with Pulp Fiction? You guys, anybody seen Pulp Fiction ever? Okay, so there's this scene where John Travolta is shooting heroin, and they do a close-up on the syringe. It's a perfect example of why HIV is so deadly with IV drug use. So what he does is he puts the syringe in his arm, he pulls back on it, and pulls blood back up into the syringe to make sure he's hit the vein, and then he shoots the drug. So what happens when you do that is you have enough blood left in the hollow part of the needle and in the syringe, which is airtight, that if you then pass the syringe on to somebody else, you're directly shooting that first person's blood into your bloodstream. I mean, HIV doesn't even have to work to infect that other person because you're just doing it directly. HIV also lives a lot longer in the cap of that syringe because it's airtight than it would if it was out on the surface of something. Okay? Same idea with tattooing, piercing, those kinds of things. If there is a hollow part to the needle, it can be a risk. All right. Other blood-to-blood contact, as I said, healthcare, first responder settings is usually where we're going to see it. Blood transfusion would have only been a risk from 1985 until about 6-7 years ago because they've started to use different kinds of tests that actually would never allow someone's blood to be used if they were in that window period. So it used to be a problem because that window period you may not have antibodies show up for 2 to 12 weeks, and if you donated blood during that time, it would still be infected. They now do these nucleic acid tests which look at the nucleus of HIV and can find it immediately. Okay. Mother to child, during pregnancy, right? So HIV can pass the placental barrier, and a mother can infect her fetus directly. Can happen during childbirth, especially if the baby's coming down the birth canal, lots of blood, stuff in the mouth and that kind of thing. And then also breastfeeding, because there are a lot of T cells in breast milk. And if you're breastfeeding a baby 4, 5, 6, 8 times a day, they're becoming in contact with it a lot. Okay. We don't get it through casual, non-sexual contact. My favorite always used to be when I went to kids and they would come up with these elaborate scenarios. So I remember one, this was a middle school that I went to, and they said, well, what if somebody's got AIDS and they have a cut on their butt and they bleed on the toilet, and then I go in and I got a cut on my butt and we sit down, that kind of stuff is not an issue, okay? I always say you're more worried about who you're shaking hands with than who you're sharing your bed with. And that's really the kinds of activities that we need to worry about. Okay, so how do we prevent it? How much time do I got?
We have 14 minutes.
Okay, we're good. I told you I'd get it done.
Unbelievable.
Okay, so how do we prevent it? Sex. Only 100% way is abstinence, not having sex. What I tell my 8th grade daughter, however, is that abstinence is just another form of birth control. It's not 100% effective unless you use it 100% of the time, right? So if you're going to be abstinent, you need to make a decision to be abstinent. And it's not that, I'm abstinent now, but I'm going to make an exception for Harold, and then I'm going to be abstinent again, right? So abstinence is really a choice you have to make and stick to. Because if you don't use it 100% of the time, you put yourself at more risk because you're unprotected, okay? Masturbation. Solo or mutual masturbation is not a risk as long as you're only touching yourself, right? Lowering the number of sexual partners. Okay, so sexual partner is really important. This was another one, is the idea of, well, I'm in a monogamous relationship. It's like, so how long have you been monogamous? Well, I haven't had sex with anybody but my boyfriend for 3 months. Well, that's not monogamy. Okay, so monogamy is really, and it's really not an option for most young people, which is that monogamy is something that happens over a decade or more, is really what the definition of monogamy is. Okay? So we have, in this country, what happens a lot is what we call serial monogamy, right? So it's okay, I was monogamous with this person for 6 months, and then I was monogamous with this person for 2 months, and then I was monogamous with this person for a month because he was kind of a dog, and then I was monogamous with this person for a year. Well, that's not monogamy because you've now had 5 sex partners over a year, okay? So lowering those number of sex partners is important because if you think about it, and I do in the AIDS class, I do a activity where you see how easy it is to spread HIV or STDs around. If you have one person who has HIV, they might affect a very wide swath of people because if they have sex with 5 people, and those 5 people have sex with 5 people, and those people have sex with 5 people, I mean, you could fill the link in a very short period of time. Okay? So really, the main issue is if you're not going to be abstinent, and you are not in a mutually monogamous relationship where you are both HIV negative and have been tested together and be given the results together, okay? Used to also have a big sign in my office that said they all lie, unfortunately. And a lot of studies back me up, which is if you ask people who have STDs or HIV, did you tell partners? The majority of them say no. I didn't want to tell them because they may not want to have sex with me. Okay, so you're talking about like the majority of people on surveys are saying that I had chlamydia and I didn't tell my partner because I didn't think they would have sex with me. Well, duh, right? Who wants to have sex with somebody with chlamydia? Oh, hey, let's, So your other option then is if you're going to be sexually active to always be protected, okay? and being on other forms of birth control are not protective, because what condoms do is provide a barrier between you and the other person's body fluids, right? And these can be either male or female, which I'm going to show here in a second, or what we call dental dams. Anybody know what a dental dam is? Yeah? What is it?
It's like a thing that you put over your mouth.
Yeah, so this is something that dentists use when you're getting like a filling or stuff. They'll put it in your mouth to protect you from the mercury or whatever else is in the filling. It's actually just a little square piece of Playtex, right? Just like a condom is. You can also, take like an unlubricated condom and cut it up the side, and that becomes the same thing. The idea is you could use it during oral sex. So you put it up against your mouth instead of the person's body fluids, right? Or if you were doing oral anal contact, you could do the same thing. So the idea is that you're not coming in contact with some other people's body fluids. Okay. Male condom, female condom. How many people have seen a female condom before? Some of the women. Yeah. Hasn't caught on too much, especially in your age group. They are awkward, and a lot of people haven't used them. But they are protective for women. It does give women some ability to have some autonomy, meaning that you can put it in before you have sex, like, before your date. You could put it in, and it could be there so that it doesn't, ruin the mood or whatever. Whereas male condoms, you got to wait until somebody's in the mood, right? All right, male condom. Important to put them on correctly. Always making sure you have some room at the tip for what comes later, right? And then rolling it down all the way to the shaft of where the penis meets the abdomen, right? So a lot of times when you hear about, condoms aren't reliable, condoms actually aren't what's not reliable. What's not reliable is that people don't put them on correctly, right? So they either don't put them all the way on, they're like in a hurry, and so they only get it halfway on, or they don't leave enough room, get the air out of the top so that, because that literally is what happens, is the condom can blow up on you. So very important to do that. Female condoms look like this. So my husband says they kind of look like a baggie. What you do there is that a woman would insert it very similarly to a diaphragm, where the head of it, which is fixed, it has like a little latex ring in it, sits up against the cervix, right? The other end, which is open, sits outside the body and covers the labia, right? So again, this could be inserted prior to sex, and you could leave it in, okay? What are the problems with this? All the women are going like, what? So what could happen? Can't get shoved up, because remember, your vagina is only about 5 inches long, so it's not gonna go through your cervix, okay? But what it can do is, because it's so long, it can get twisted. When so if you don't know how to insert it correctly, or you haven't had some practice, it kind of gets twisted, and then that makes it hard to use it correctly. The other issue that a lot of women would have is, because it is outside the body, is that when you go to have sex, the penis actually goes on the side of it instead of inside. I mean, you have to kind of consciously find where the ring is and make sure that the penis is going inside the ring. Okay. Everybody's got to make a decision on whether or not it's something that they want to try. But it does give you protection. Okay, so some condoms do's and don'ts. Use latex or polyurethane condoms, okay? Do not use natural skin condoms. So some of them are what they call natural skin. They're made out of lamb intestine, which to me is disgusting anyway. Some people say they feel more natural, like you're not really wearing a condom. The problem is that they're porous, and the holes are big enough that viruses and bacteria can get through. Sperm are big. Like sperm you can actually see pretty easily under a low level of a microscope. They can't get through. So they're okay for pregnancy, but not for disease transmission. Only water-based lubricants. So you do not want to use things like Crisco, vegetable oil. You cannot imagine some of the stuff I've heard over the years. Motor oil. Okay? So So you want to use water-based lubricants. So KY jelly is a water-based lubricant. Most of the stuff you can find in the Rite Aid or CVS are water-based kinds of lubricants if you wanted to do that. Also, and this is something that's actually changed over time, is you actually don't want to use spermicidal condoms. So there are some condoms that have spermicide in them that are meant to kill sperm. They've actually shown to dry out the vaginal wall of women, especially, and make them more susceptible to HIV. So you do not want to use spermicidal condoms. Let me go back. One idea, too, is if you're practicing oral sex and you don't have a dental dam, right? You want to go to your dentist and say, "Can I have some dental dams from you?" They do sell them in some of the sex shops and things. But like I said, you could cut a condom, unlubricated condom up the side and use that. If you're practicing oral sex on a man, you can use an unlubricated. Some condoms actually have mint flavor, chocolate flavor, strawberry, et cetera, et cetera. You could use that. If you're desperate, you could use saran wrap.
Oh my God.
However, you don't want to use microwavable saran wrap. Anybody want to guess why? Everybody's like, "Oh my God." It actually has holes in it. So, the microwave has to go through it so it doesn't pop. You've seen that happen in microwaves and stuff. So the microwavable saran wrap have holes, pores in them, so you don't want to use those. Okay? All right, blood. How do we prevent it from blood? Don't share needles. Okay? So an IV drug user is not at risk if he or she is not sharing needles with anyone and not having unprotected sex with anyone. It's the sharing that really puts you at risk. If you are sharing, you need to either clean the needles. So often what they do is teach IV drug users to clean it with bleach and water, because bleach will kill it on contact. This kind of stuff, blood and organs should be properly screened. You want to make sure if you need a heart transplant, where that heart's coming from. They're usually pretty good about that kind of stuff now. A lot of lawsuits have required that to occur. This is an interesting one, which is called autologous donation. So let's say you're going to have knee surgery or some kind of surgery. They usually will ask you to bank your own blood over a period of time. Okay? And that's actually the best thing you can do because you don't have any problems with taking someone else's blood or body fluid. And then birth. Interesting one that we've started to mandate in the United States is HIV testing when pregnant. Okay, so New Jersey has mandated HIV testing when pregnant. Pennsylvania's is opt-out, meaning you have to say to them you don't want to be tested for HIV. What we have found is that if women are identified as having HIV and we start them on some treatments during pregnancy right away, it reduces the risk of having that baby born with HIV significantly. And so that's why that mandated testing is so important. To bottle feed instead of breastfeed, okay? To give HIV drugs to the baby as soon as it's born to try to combat HIV from actually infecting that baby. And then there are some studies that look at rates of C-section. So C-section, usually the baby is exposed to less blood and body fluids. And there is some evidence that doing a C-section on women will reduce the risk for the baby, but it actually is more risky for the mom. So it's kind of it's a problematic decision on that one. And then that's my contact information. I did it. Told you I would do it. Any questions? Questions? Yeah.
Do T cells regenerate, or is it just like you have it when you're
They don't regenerate, but the body will usually produce more if it's needed. So it's like, the body can tell when it's not in the state that it's supposed to be in. The problem is that the body cannot regenerate enough of them at the same rate that there are HIVs. And because of that, you get this, you got more HIVs than T cells, and once that happens, the T cells can never catch up. Yep.
How does medication stop the process or stuff?
Take my AIDS class, and then we know. There are a couple different ways. So there are a number of different medications called antiretroviral medications. Some of them interfere with the replication of the RNA to DNA. Okay, those are called non-nucleosides transcriptase inhibitors. All right. There's some that are called protease inhibitors. What those do is keep the baby HIVs from becoming adult HIVs so that they can't infect other T cells. There's some drugs that try to keep HIV from docking onto the T cell to begin with. Okay, those are called fusion inhibitors. So they're trying a variety of different ones. And what they found is if you give someone a couple of drugs from a couple of the different classes, it's pretty effective at keeping HIV at bay. So it doesn't get rid of HIV, but it keeps it from killing so many T cells that you don't have an immune system response.
One last question.
Anything else? Yes?
Is the virus still mutating and that's why it's so hard, or is it pretty steady?
The way that HIV infects people is pretty fixed. What does change are the protein coats, and that's why it's hard to treat it, because HIV is pretty smart in the body. So it will change its protein coat slightly so that a drug doesn't work on that anymore. And then you get people who are immune to the drugs. Good. All right, I have condoms. So come take some. Protect yourself. Be smart. Okay?
Thank you very much. That was probably about 2 days of a 5-day course.
Yeah, that's right. It was quick.